My name is Dan Carden. I'm the Member of Parliament for Liverpool Walton and President of the Forum of Young Parliamentarians at the Interparliamentary Union. But I am also an alcoholic in recovery. I'm the first member of the UK Parliament to speak openly about being in recovery, and I sincerely hope I'm not the last. I was elected 6 years ago to the House of Commons. I'm over 4 years in sobriety and recovery, and it's 2 years since I spoke in the House of Commons to talk about my experiences. And that's because I had a choice to try and keep my treatment and recovery from alcoholism, which I consider a health issue, a secret, or to be open and at the same time become an advocate for visible recovery. And so I took the decision to celebrate and share my sobriety. I chose to try to show others that there is a way out, and I chose to accept my illness and reject the shame and stigma of addiction. In the United Kingdom, addiction is a public health crisis. Drug and alcohol deaths are at record highs, and despite the scale of the problem, despite the enormous cost to the economy and society, there is a long-standing lack of political will to face up to, especially alcohol-related harm. And so I've tried to put my experience to good use. I've tried to use my position as a Member of Parliament to raise awareness of addiction. I've tried to champion visible recovery and influence much-needed policy change. My calls have included a proper independent review of alcohol harm that would lead to a government strategy to tackle it. And I've led successful campaigns for more funding for treatment and recovery, and I've led debates and committee inquiries to highlight failings and encourage change. But most importantly, I've tried to create the space for experts to be heard and for evidence-based policies to be implemented. Despite these efforts, there is a lack of urgency and there is an attitude of indifference towards addiction. And I am certain many of you in this room here today will have spent many more years than I have feeling frustrated by the lack of progress and dismayed by the dismissal of evidence-based measures. Time and again, we are faced with the biggest barrier to progress and recovery: stigma. Substance use disorders are just that, disorders. Becoming dependent on a drug, and alcohol is a drug, is not a moral failing or a character flaw. For many people, alcohol and drugs are a solution. They're a way to cope, to self-medicate, and to look after oneself when it's easier to access than the proper health care that people need. So what can we do here in this room? Well, yes, we must build compassion and understanding to support people to ask for help without judgment or discrimination. And yes, we must challenge governments to follow the evidence-based policies to reduce harm and a health response to drug and alcohol addiction. But I believe if we want real change, we must beat that stigma that prevents so many people seeking help and prevents so many governments from taking the proper, meaningful action that's needed. And I'm convinced that this forum is the right place to drive forwards that change, because it's time for powerful international advocacy on tackling the harms of addiction. Addiction is a global crisis. It's a very human phenomenon, and it takes countless lives and causes untold misery. And so I hope the World Health Organization Forum we're in today can act and provide that global leadership and advocacy that is so desperately needed in countries around the world. Thank you.